Good morning. Thank you for joining us today for this month's University of Wisconsin Division of Extension Badger Dairy Insight, a monthly webinar series offered on the third Tuesday of each month. The Badger Dairy Insight provides the latest research and dairy-based information to improve animal welfare, breeding and genetic selection, automation and modernization, and nutritional decisions for producers, dairy workers and managers, and agriculture professionals. My name is Erica Bierstrom. I'm a regional dairy educator for Brown, Door, and Kewaunee counties, and I'll be your moderator for today. We hope to provide this opportunity as an educational and informational discussion on today's topic, a clearer picture using ultrasound to detect respiratory issues in calves. This is a webinar format. Please add any questions or comments in the Q&A button at the bottom of your screen. This webinar is being recorded, and we will provide you with a link to the recording within a week, with the hope of sharing it with others you work with. Today's speaker is Dr. Theresa Ollivett. Dr. Ollivett is a veterinary epidemiologist and board-certified large animal internist. After graduating from the College of Veterinary Medicine at Cornell University in 2004, Dr. Ollivett practiced in predominantly mixed large animal clinic in northern New York. She returned to Cornell University in 2007 and completed a residency in large animal medicine between 2008 and 2011. In 2014, she completed her doctoral studies at the University of Guelph by validating lung ultrasonography as a means of diagnosing respiratory disease in dairy calves. As an associate professor in the Food Animal Production Medicine section at the School of Veterinary Medicine at UW-Madison, Dr. Ollivett continues to advance the academic, veterinary, and professional dairy industry's awareness and understanding of lung ultrasonography as a means of diagnosing and monitoring cattle health and the varied impacts of interventions on dairy farms. With that, I'd like to welcome Dr. Ollivett.
Thank you. I appreciate that introduction. I presume you can hear me okay, and my screen is sharing. Everything is good. Flag me down if anything technologically goes awry, as sometimes does happen in these settings, but I appreciate the opportunity to be here to talk about a topic that I'm very passionate about. I've spent a lot of time over the last 15 years trying to learn more about, figure out, and that's respiratory disease and how we can use ultrasound to help manage these calves. So hopefully I'll be able to provide some answers to questions today, and I do look forward to the Q&A section at the end as well. Sometimes we learn more during that than we actually do during our presentation. So I'll go ahead and get started. So why is lung ultrasound kind of so important? Why have I found that I spend all my time trying to figure this out? And it really comes down to this term that I didn't create, but came from a colleague of mine, Dr. Sam Behringer.
Terry?
Yep.
Could you maybe turn off your camera? Your sound is coming through a little kind of shaky. That might help.
How about that? Was that better?
Much better.
Much better. See, there's always technological issues going on here. So if we get back to this idea of fidelity of diagnosis, that just really has to do with how confident are we in our diagnosis? How confident are we that we are seeing a condition and calling it the correct thing? Or are we not seeing something and not calling it anything? And respiratory disease, or BRD, really is difficult when it comes to having a high quality diagnosis, because we have this kind of iceberg phenomena that happens where a small fraction of the population of calves with respiratory disease are clinical, right? So that's the top of the iceberg that you see above the surface of the water. And what we've learned over the last 10 to 15 years is that there's a huge part of that iceberg under the water, which is that population of calves with subclinical disease. So our ability to be really accurate, just visually looking at calves, is really poor. So I have these three videos, these three calves have traveled all over the world with me over the years. So I'm sure some of you guys, if you're watching, maybe have seen this before, but these are three great examples of the spectrum of respiratory disease that we can see in our young pre-wean calves. I will preface that my experience, my area of expertise is going to be in those baby dairy calves. So calves that are still on milk. So all of the data that I'm going to show you is going to be focusing on those animals. So this calf we have on the top video, 5-week-old calf, and you can see when he was up walking around, his ears are droopy, he's got a thin top line, he's got this plastic stance. When I come over to the side, you can see where he's standing with his head and neck outstretched. He's got a snotty nose, and he really, by anybody would say, oh, this calf has chronic pneumonia, right? That's a classic textbook image of a calf with chronic pneumonia. Anyway, this 10-week-old calf here in the middle, who you can see I was just shaking her trachea, I was inducing a cough. She coughed multiple times. She's got droopy ears on both sides. So she looks like she has clinical respiratory disease during my visit as well. And if you'll notice, she's 10 weeks old. She ought to be, as close to size as I have her behind her. But she's very, very stunted. So at 10 weeks old, she's only weighing 105 pounds. So it'd be easy to say, well, obviously she's a chronic respiratory. She's got clinical signs today. She's skinny. She's small. Obviously, it's chronic respiratory. Then we have this calf here on the bottom who's 3 weeks old, bouncing around in his pen, sucking on my finger, cough, no nasal discharge, no abnormalities on his physical exam. And so we say, well, obviously this calf is normal, right? But when we actually look at the lungs of all three of these calves, and these calves were all euthanized within about an hour of these videos that were collected, and necropsy was performed. So we can see we're looking at the right lung for each calf. And just to orient you, the way these images are set up, the calf is lying on their left side. So the head would be over here to the right of the image. The tail would be over here to the left side of the image. Here's the heart right there, and then the top of the image would be kind of the top of the rib cage towards the spine, where the bottom of the image would be like the sternum. So just to orient you, front of the chest, back of the chest in each one of these images. And why I show these three calves, because they show a spectrum of clinical disease, and then I show the necropsy findings. We can see that that calf on the top and the calf on the bottom have two lung lobes, which are firm, red, consolidated lung tissue, which is indicative of having a bacterial pneumonia or bacterial infection. Each of these lung lobes in the front of the chest, it's about 5 or 6% of the mass of the whole lung. So you say that this first calf has 10 to 12% of his lung affected. The calf on the bottom also has two lung lobes, consolidated, so the same amount, 10 to 12%. Whereas this calf in the middle has just very small little lobular lesions, maybe 1 or 2% of the mass of the lung. So the point being here is that we can't equate the severity of the clinical signs that we see with the severity of the lung lesions that we see in the chest. Right? And that's what makes diagnosing respiratory disease so difficult, because we can't judge severity just with our naked eye. We also can't say for sure that an animal doesn't have disease with our naked eye, right? And this is where the ultrasound really comes into play, because it's going to look at these lung lobes, right? It's going to look through the skin, through the body wall, and it's going to tell you, is there air in the lung, or is there pieces of lung that don't have any air in it because there's infection there, right? It's as simple as that, what we're using the lung ultrasound for. So it doesn't matter what the calf looks like on the outside, you're going to get an accurate assessment of the lung, right? So it's going to increase that fidelity of diagnosis, because now we have the ability to identify these calves with subclinical VRD, subclinical respiratory disease. We also have the ability to determine whether or not a calf that looks like they have respiratory disease truly does have respiratory disease. So this calf has clinical signs associated with respiratory disease, right? The droopy ears, the cough. But her lungs are really not very remarkable, right? So she does have pneumonia, very, very mild pneumonia, right? Not enough pneumonia to make her be so stunted, right? So knowing this, we use an ultrasound to see that, when you're with this calf, leads a veterinarian or whoever's doing the ultrasound to say, all right, we need to investigate more because there's something else going on in this calf. She does have clinical disease today, but that's not what's been contributing to her poor growth over the last 10 weeks of her life, right? And then this calf's instance, we ultrasound her abdomen and actually found some enlarged lymph nodes that suggest salmonella infection. And on testing, we actually confirmed that she was a chronic salmonella, right? So she had an inability to properly absorb nutrients through her GI tract, which is why she was so stunted, so small. So not only does the ultrasound help you get better at determining if a calf has pneumonia and how severe it is, it also helps kind of pave the way for figuring out, well, it doesn't seem like it is actually respiratory disease, so I need to investigate further, right? So that's a really helpful phenomenon when it comes to this fidelity of diagnosis, right? So I'm not going to go through all of the research that's happened in the last decade or so, but it's been substantial. So I got involved in my first project using lung ultrasound out on farm about 2010. Prior to that, there was a handful of papers in the literature about using lung ultrasound to identify pneumonia in baby calves. Since then, you can see, it's kind of skyrocketed. There's lots of research going on out there, which is really, really great to see. I could spend 3 days kind of talking about all that research, but I'm just going to give you kind of the snippets since we don't have a week to be here. So this lung ultrasound, this idea of doing lung scanning on the farm is a fast technique, right? With one person can restrain, scan the calves, and record the findings. You can do 45 calves an hour in individual housing, right? So it's a rapid tool. It's a very accurate tool. So with a sensitivity of greater than 88%, what that means is if we had 100 calves with lung lesions from pneumonia, we would find at least 88 of them with the ultrasound, all right? The sensitivity of clinical exam is only 60 to 70%, right? So that means of 100 calves with lung disease, your clinical exam is only going to identify a little over half of them. Or auscultation, which is using your stethoscope to listen to lung abnormalities, you're only going to find maybe 6 to 10 out of those 100 abnormal animals, right? So this is just some evidence saying we can trust the results that we get from the ultrasound to be reliable, that they are going to find those calves with lung lesions. But it's really important, and I'm going to harp on this throughout the talk, technique is critical. Absolutely, garbage in, garbage out applies in this scenario. So it's so important that veterinarians and operators of the ultrasound are properly trained to know exactly what they're looking for. And then as important is what to do with that information. And I'll talk a little bit more about that in a minute. We have found that there are short-term outcomes associated with the lung lesions that we see on ultrasound in these baby calves, right? So several studies, there's more than just these three, but several studies will show that if a calf has an ultrasonographic lung lesion in a pre-weaned calf, it's going to negatively impact growth. So they're not going to grow as fast. We can measure vaccine response. We can measure antibiotic response. I'll show you some data on that in a minute using the lung ultrasound. There is evidence that there are long-term outcomes associated with lung ultrasound findings, right? So increased risk of dying before first lactation, increased risk of removal and decreased pregnancy. And then even further down the road, while they get into their first lactation, there's an association with decreased milk production. So if we see at least 3 centimeters of consolidation on the ultrasound in a calf during the first month or two of life, that's been associated with 525 kilos, which is going to be about 1,200 pounds of first lactation milk, right? So that's a real number. It's a real impact on the bulk tank, especially if you take into consideration that some cohorts of calves that you're raising, maybe 50, 60, maybe 80% of that group of calves will have at least 3 centimeters of consolidation, right? That 3 centimeters, I just really want to point out that that paper used a 3 centimeter cut point simply because this was one of the early papers and we didn't know what the appropriate cut point would be, right, in that study. So we kind of arbitrarily chose 3 centimeters. Now we've got enough data to say calves that have 1 centimeter or more of lung consolidation in that early pre-weaning phase are negatively impacted in their growth and their likelihood of becoming clinical, their likelihood of not doing as well in the future, right? So you'll see different cut points about the size of the lung lesions, 3 centimeters, 1 centimeters. And it's good to know, especially if you're a veterinarian doing the scanning, where those cut points come from, what they mean, and when is it appropriate to use one versus another. Okay. We have also learned that the lung consolidation that we can see on an ultrasound is a heritable condition. So we did a study, um, man, time goes by. It's a few years ago now, but we looked at about 1,100 calves. We scanned them at 3 weeks of age, and then we scanned them again at 6 weeks of age. And we found the heritability estimates of those calves that had lung lesions at 3 weeks of age was 0.21. That's a pretty darn high heritability estimate. That means that about a fifth of the risk for developing lung lesions when you're 3 weeks old comes from the genetic side of the equation, not the environment. Right? In those calves that develop lung lesions at 6 weeks of age, the heritability estimate was 0.08. Right? So that suggests a lower contribution of risk for these lung lesions due to the genetics, right? So calves that are slightly older, it's probably more environmentally driven. Calves are a little bit younger, those lung lesions are a little bit more genetically driven, right? So it's something to just tuck in the back of your mind to figure out, if we're not doing better as an industry from a management perspective, man, maybe we need to really start looking at the genetic side of respiratory disease to figure out how we can really get on top of it. Also learned through these different studies that the resolution of disease after treatment is not guaranteed. I'll show you some more specific data in a minute, but just because clinical signs get better, right, the snotty nose, the cough, the fever goes away, does not necessarily mean that the lung infection itself is actually resolved, okay? And then we've also seen that attitude scores and feeding behavior are often associated with clinical pneumonia, so calves that are visibly sick from pneumonia, but they're not associated with subclinical pneumonia, which kind of makes sense, right? Subclinical disease means they don't show any outward signs. So they're acting normal, right? So their attitude is fine, they're eating fine. And so it's important to recognize this, especially when you're hearing literature or reading papers or someone's trying to sell you a product, if they're just relying on attitude or appetite to indicate whether a calf is abnormal, it's not going to pick up calves with subclinical disease because it's subclinical. Those things aren't affected, okay? So we've learned a lot. This is just a summary of some of the literature that's out there. There's a bunch more, but I think this stuff kind of sets the basis for how we can trust the results that we get from properly performed and implemented lung ultrasound. All right. So the next few slides are going to show you just some specific data points through some challenge study that we did, as well as a commercial in the field on farm study as well. So this particular study, we were comparing antibiotic treatment to saline treatment in a group of calves. We wanted to see, can we watch lung lesions resolve after we experimentally challenged them. So this is a group of calves. We had 28 calves that came in, and we infected them with Pasteurella multocida, one of the more common bacteria associated with pneumonia in young calves. And so what this is showing, this top figure is showing the proportion of calves that score ultrasound 3 or higher, so greater than ultrasound score 2. So what that means, we'll get into the scoring in a minute, but what that means is the lungs in those calves on ultrasound had at least one lung lobe completely consolidated, such as this calf does on the top, or it could have had 2 lung lobes completely consolidated, like the middle calf here, or 3 lung lobes consolidated, like in the bottom calf, right? And so the bottom axis here is just showing us the time points. So we start one day before we infect the calves, and then we take measurements at 2 hours, 6 hours, 12 hours after we infect the calves, and then once a day up till 14 days when we euthanize the calves. So the dark gray boxes are going to be those calves that were given just the saline, the placebo control. The lighter gray boxes or bars are going to be the calves that received an antibiotic, and these calves were given ampicillin or Polyflex. And what we could see is at 12 hours, between 12, 24 hours, about 70% of the calves develop pneumonia that looks like the calves here on the left-hand side of your screen, right? And it was equal between the two groups. So 24 hours, a little over 70% of the calves had bad lungs. And the calves were underwent 3 days of treatment, and they were probably treated right around that 12-hour mark for about 3 days. And what you can see in this nice pattern is those calves that treated with antibiotics, the proportion of calves with severe pneumonia dramatically went down, okay? And the calves that were given just saline, right, no antibiotic, those numbers stayed persistently high throughout that 14-day study. So this was a neat early study to say, yes, we can administer a treatment and we can actually see the lungs respond to that treatment, to that antibiotic. The other thing, though, that I wasn't expecting, what we could see is that a few days after, so most of the calves, just to give you some perspective, a 3-day treatment, most of the calves would have been done with their antibiotic over here between 4 and 5 days. A few days go by, and then we start to see the proportion of calves with pneumonia, severe pneumonia, increasing again. Okay, so this tells me that these calves are starting to relapse, right? Which isn't what we want, okay? And this is not a problem with the antibiotic we were using. We see this with other antibiotics as well, and I'll show you that here in a second. So good. We can see that ampicillin will make lung lesions go away, but we have to be aware that those lung lesions can come back, okay? The bottom figure here, this is just highlighting the proportion of calves that had clinical evidence of disease, who looked visibly sick. So 2 things I want you to notice here. One is, again, the gray bars are going to be the antibiotic treated calves. The dark bars are going to be saline treated calves. If you just look at those calves over time, you really can't tell the difference between the 2 groups, right? Is one better than the other? Is one worse than the other? It's kind of all over the place, right? So it's not predictive of a treatment effect. Also, you can see that these bars are significantly shorter than the bars on the top figure, right? So whereas 70% of these calves developed severe lung lesions, from a clinical aspect, very few calves looked visibly sick throughout that study, okay? So again, highlighting the fact that if we don't use a tool like lung ultrasound to characterize lungs, we're not necessarily going to know who actually has disease and how severe that disease is, okay? That's really important. Some people might say in that study, that's a laboratory study, it's an artificial, you created the pneumonia, maybe it's not like that in real life. Well, this is a separate study where we did on 2 commercial dairy farms where we randomized calves to get treatment based on their presentation of their first respiratory event, whether it's clinical or subclinical, right? So they got randomized to receive an antibiotic or saline based on that first episode of disease. So what we saw here, BRD1, is just the breakdown of what proportion of calves had clinical disease versus subclinical disease at their first respiratory event. So you can see a little over half of the calves in this study, again, 2 dairy farms, had clinical disease, a little under half, so 43% of those calves, the first time they developed respiratory disease, had subclinical disease, okay? So we randomized them, got antibiotic or saline, and then we followed them through the weaning period. So BRDW is going to be their lung status at weaning, which for this study was about 52 days of age. And what we can see that clinical respiratory disease is down to 15%, right? So we started with 56% clinical, and now at weaning, we're at 15% after treatment. And so you might think, well, that's good. That's a whole heck of a lot fewer calves with clinical disease. But because we had the ultrasound component, we actually saw that 65% of those calves now actually has subclinical pneumonia, right? We started with 43% subclinical, and now we have 65%. And so if we're not using ultrasound in this scenario, we're going to be misled thinking that things are working pretty well. Using the ultrasound, we can see that these calves really are not approaching the weaning period with clean lungs like we would want them to, right? To give them the best chance to get through weaning successfully. The other part of this that is a bit worrisome is that all of these calves were treated once, right? 80%, about 80% were treated twice, right? So 2 rounds of antibiotics, and 65% of these calves were treated 3 times, right? So 3 rounds of antibiotic. And so with that in mind, 65% of the calves are treated 3 times, and still 80% of the calves, 15 plus 65, 80% of the calves still had pneumonia at weaning, right? So if you think about the dollars and the labor that gets spent on treating calves for respiratory disease, and we look at the fact that we're not accomplishing what we want, right? Resolution of disease, in the face of heavy antibiotic use, that's really worrisome, right? Again, it's not specific to one antibiotic versus another. I think it has to do with how we use those antibiotics. Okay. Right, really get kind of lulled into a false sense of security. All right, I'll get into Wean Clean here shortly, but I would just want to point out, right, they're not weaning clean. In order to have calves, get through that really stressful transition process of weaning, their best bet is to do it with clean lungs, right? So resolve any disease that they have prior to weaning so that they don't have to worry about dealing with that infection in their lungs. They can worry about the social factors, the facility factors, the diet factors that they have to worry about going through that weaning transition. All right. So who does this lung ultrasound stuff? So for a while there was about four of us between the US and Canada. This is Dr. Liz Cox, Dr. Sebastian Buczynski, myself, and then Dr. Sam Behringer that were running around the countryside teaching people how to do lung ultrasound. And what's been really cool is that now, and I may have some people on the call, these people may be your own veterinarians, but now that we're teaching veterinary students, at least here in Wisconsin, which is unique, this is not like this in every vet school, but in Wisconsin, any student that is going to graduate and do dairy practice, if they want to work on dairy calves, they're going to graduate knowing how to do lung ultrasound, right? This is a new thing. A lot of practitioners, or most practitioners up till 10 years ago, weren't taught this skill, right? So what's been really cool is to see, here's the cover of a Progressive Dairy with a former student who is now using lung ultrasound in practice and really doing a phenomenal job. Here's another Wisconsin practitioner up in Seymour, Wisconsin, Dr. Kendra Wills. Here's one of our students out in California implementing lung ultrasound and just a couple other practices here in Wisconsin. It's fun to see these new grads out there. Many of these aren't new grads anymore because it's been a few years, but they're really leading the charge. So it's been fun to watch new grads, younger veterinarians taking this tool, taking it out to dairy farmers and providing them with really high quality information and new tools for managing those calves, right? You'll hear some people, this is a little bit more of a philosophy in Europe where you say, oh, we can't scan a whole bunch of calves at once, right? It's not feasible or economical. And what vets like those veterinarians I just showed on the previous slide have shown, as well as others, that producers do find the information gained from lung ultrasound to be valuable. So a couple of years ago, I just put out on Facebook, the Vet Truck, it's a group for bovine veterinarians. I said, okay, if you're offering a lung ultrasound to your producers, how many calves a week are you scanning, right? And this is Facebook. This is not a Journal of Dairy Science paper. And so this is not high quality, substantial data here, but it gives you the idea. So of the, almost 24 people that responded, and the vets that responded were from East Coast to West Coast, right? California, New Jersey, Pennsylvania, Wisconsin, Washington, Ohio, all over. So almost 40% of those respondents said we're scanning at least 200, more than 200 calves per week, right? This is California, Wisconsin, Georgia. If you do the math on that, right, and this is a few years old, but if you do the math, 200 calves a week equals 10,000 calves a year. So that's a lot of animals, right? So when people are worried, oh, it's not feasible to scan a bunch of calves at once, it really is. I think the fact that these veterinarians are doing it tells us that they are able to demonstrate the value to the producer, and the producer wants them to come back and do it, right? 200 calves per week, 10,000 calves a year, right? The next question that I often get is then, well, yeah, they can do it, but is it really worthwhile, right? Is it going to pay for itself? Is it worth spending the money on it? So a while back, I wrote a little article in Hordes about whether or not lung scanning is worth the cost. And for each farm, you can calculate this out for yourself, because there's going to be some farms where, maybe it's not worthwhile. Maybe you're better spent spending money on something else. But if you're a dairy or you work with producers that have a high incidence of subclinical pneumonia, it's probably almost always going to pay to find those calves early and get them treated, because we get them treated early, we prevent them from developing clinical disease, we keep them growing through that phase better, and we have a better animal at the end of the day. So all this slide is showing, and what I did for that Hordes article was just look at one farm's data. This was a farm that had been scanning for several years. And this farm has a pretty intensive scanning program. So they scan all of their calves between 10 and 35 days. At this point, they're scanning everybody between 10 and 35 days of age, and then treating based on what the lung ultrasound was saying. So how I calculated this partial budget was I looked at the number of pneumonia events in the scanning aged and the post-scanning aged calves. And we had data from 2018 before they started implementing routine scanning, and then data from 2019 to 2022 after they started implementing. And so I calculated all of those events out of dairy comp. I calculated the amount of drug volume used, the overall amount of drug volume used, the veterinary fees, what the calf mortality did during that time, and what the calf value was at 100 days of age, 180 days of age, right? And so you can see here, just looking at the number of animals that were raised, the number of pneumonia events in that group of animals, the number of animals that died less than 6 months of age or 180 days, the number of calves treated in that 10 to 35 day period per 100 calves raised in the system. I looked at the number of calves treated in that post-scanning phase per 100 calves, and then how many calves died per 100 calves raised, right? So that's kind of the breakdown of the table. When you convert that over into the drug volume, the veterinary fees, the mortality, and whatnot, what the data said was that, so for this particular farm, 2,000 cow dairy, they treated twice as many calves for pneumonia in that young group, the 10 to 35 day old calves that were getting scanned. That makes sense, right? Because we're using a more sensitive tool, we're going to find more disease than we would have previously when we were just using our naked eye to identify who's affected. But they treated, so that's a little scary. If you're a producer and you want to delve into this routine scanning business, you've got to be aware that you will treat more calves early when you're scanning than you did before. And that's normal, and that's to be expected, and that's okay. The big picture is that they treated 5 times fewer calves in that post-scan phase, so between 36 days of age up to 180 days, right? 5 times fewer calves. Think about the calves in that age group. They are a lot bigger than the calves in the 10 to 35 day old group, right? The calves that you're scanning. So if we think about the amount of drug that's being used to treat those older, heavier calves, right? That's a lot of volume that's being saved, right? You're treating 5 times fewer calves. You're using significantly less antibiotic, which means significantly fewer dollars getting spent on drugs, right? Their mortality also decreased from about 3.5% down to 1.5% in this time period. 3.5 is not shabby, guys, right? But man, 0.5 is really pretty awesome. And ultrasound is not curative, right? It's not going to make that pneumonia go away. It's not going to keep that calf alive. But what I think happened in this operation is when you have a veterinarian out there collecting this data, working with the producer, the owner, how to answer very specific questions, and how to use this data to highlight where things have gone wrong in the system. If you get an uptick in disease, you get more tuned in to where the problems are and when they're happening. So that's why mortality drops. It's because you become better managers, because you have better information to help guide those decisions, right? They would take trailer weights of their weaned animals and document this. So their weaning weights, again, trailer weights, which are, it's not as nice as having an individual average daily gain, but their average weaning weights went from 160 to 220 pounds. That's substantial. That's a lot more growth because we're better managers, because we're paying more attention to passive transfer, because we're feeding these calves better. And the employees are just kind of happier there, right? Things are just kind of clicking along. So when you put the dollars and cents to it, it works out for this farm, again, 2,000 cow dairy, intensive scanning program, right? Every calf gets scanned 3 to 4 times before 35 days of age. It works out for them to be a little over $500 of benefit per 100 calves to the system. So every producer should do this in your own operation to figure out, is it worth it for you? In this system, with high level of subclinical disease, even in the face of an intensive scanning program where you're paying the vet out there, it's a benefit for them, okay? All right. So we can answer a lot of questions about respiratory disease using the ultrasound, right? We can look at how often new cases are developing. We can look at the amount of existing cases. We can see onset of disease. How old are the calves when pneumonia starts? That's an extremely important outcome to look at. If you don't know when pneumonia is starting in your calves with confidence, it's going to be very difficult to accurately manage those calves, right? You need to make sure any vaccine that gets implemented gets implemented well before disease starts, right? If you have subclinical disease lurking out there for a few weeks before clinical signs start, you may actually have disease going on before you actually give the vaccine. So it's very important that you know when pneumonia is starting in your calves. It's important to know the duration of disease. How long are these lung lesions lasting, right? Are they persistent because we're not treating them properly? Are they persisting because the calves don't have good immune systems because there's lots of failure of passive transfer? Are these lung lesions persisting for a long time because we're not finding them soon enough and getting them treated early enough, right? We can figure out whether or not your metaphylaxis is working, those treatment protocols, if they're working. We can assess the competency of the caregivers. So are they finding the right calves at the right time, doing the right thing, right? We can investigate and figure out whether the metaphylaxis you're doing on arrival is working, right? So you're a calf raiser and calves come in at, whether it's 2 weeks or whatever, and we can figure out if giving them an antibiotic on arrival is useful or not. We can use it to diagnose rib fractures. This is just kind of an incidental thing. About 5 to 10% of calves will have broken ribs when they're born, and most will never show any signs associated with that. But when we're doing routine scans, weekly scans on at-risk calves for farms, if we see an uptick in the number of calves that have rib fractures, then we might have to go and figure out, well, why are a whole bunch of calves born with rib fractures now, right? Are they coming out of heifers that are too small? Are the calves themselves too big? Or are we just being too aggressive when we're pulling calves? And it can also help with treatment decisions. So it can really be a bit overwhelming when we think about all the questions we can answer with our ultrasound. But the way I like to look at it and kind of break it down is to think about what are the most important things that we need to know about the calves. What can the calves tell us? And I always like to say, the lungs are the window to calf health management. So I think of the lung as an indicator organ. So if we see a lot of respiratory disease, I'm not so worried about viruses and bacteria. I'm worried more that it's a symptom of management failure. Where are we going wrong? What did we break in the system? So we have too much passive transfer, or we have diarrhea, or septicemia, or poor nutrition, dirty environment, cholesterol, heat stress. We're going to see that all manifest in the lungs, right? And so it's going to really help us figure out where things got broke in the system once we know that there is an abnormality in the lungs. Okay, we're not going to chase the bacteria, the viruses. We're going to go chase those risk factors for pneumonia, right? That's where the management tool side of things come into play. This Wean Clean philosophy, which again I mentioned earlier, is this concept of making sure we raise calves in a way to minimize failure passive transfer, minimize diarrhea, minimize all these other bad things so they get to through the weaning process when they clean lungs is really meant to set them up for success. I'm going to skip through these slides here just for a second because I want to touch on one thing about this Wean Clean business before I go into those other slides. So we had that prior slide with like 10 different questions there. So if you're a veterinarian on the call and you're worried about starting this, or if you're a producer and you're not quite sure how to implement this, figuring out which one of those questions or which 2 or 3 of those questions is most important to ask can be a little bit cumbersome and a little bit intimidating. And so when I developed this Wean Clean approach, I outlined 4 points where we can implement lung scanning to answer very specific questions, right? It helps kind of focus the efforts and helps you figure out, all right, who do we need to actually scan and what are we going to do with that information? Because if we don't have a clear plan, we don't have a clear question that we're trying to figure out, then the implementation part kind of falls apart. So I got asked recently, veterinarians can do the technical job of scanning lungs, right? But what makes a difference between a vet can do the technical job versus a vet that can implement and use the data in a way that actually helps manage those calves? And those are 2 very different veterinarians. And you need a veterinarian. If you are a veterinarian, you want to be the veterinarian that knows how to take the lung ultrasound data and do something with it. The least helpful thing a veterinarian can do is go scan a bunch of calves, hand the producer a sheet of paper with lung scores on it and say, there you go, this is how many calves you have with bad lung scores. The most important thing is to figure out what do you do with that information next, right? And so that's just, I can't stress that enough. To be successful, to make this make sense in your operation, and to make it help you manage those calves better, you've got to work together to figure out what you're going to do with that information. So the strategic points, the Wean Clean philosophy, it will help you do that. It's going to define some questions, right? how many calves have pneumonia at the start of weaning? How many calves have either high or very low lung scores, like normal lung scores at their first treatment? How many calves still have disease after they've been treated, after treatment 7 to 10 days later? And how many calves within certain age groups have disease? These 4 questions help you figure out, is pneumonia in the pre-weaning period a problem, right? Too many animals are hitting weaning with abnormal lungs. They're telling you whether or not the lungs are too severe when they're getting treated for the first time. It's telling you whether or not they're responding to treatment like they should. And then the 12/7 scans is telling you exactly when does disease start, right? So these are very 4 practical strategic points to implement lung ultrasound to answer questions that you can do something about, right? If you got too much disease, you got to look back and figure out, all right, what are we doing wrong? Passive transfer, cleanliness, nutrition, overcrowding, ventilation, all of those things, right? If we're not finding calves soon enough, you have to figure out why. If they're not responding for treatment, you need to figure out why. So this approach is really helpful from the implementation side of things. I'm going to go back to these slides because one thing I want to touch on is that one benefit of doing routine scans is that you get independent of calf. And what I've learned is to pay attention to manure, because one of the biggest risk factors that I see for respiratory disease in young calves is going to be abnormal manure. And if you're not in the calf, sometimes you're just in the pen with the calf and it's not documented. You don't realize how significant the problem is. I spend a fair chunk of time troubleshooting respiratory disease, and when I get to the farm, I actually end up working more of a GI issue first, because if we have abnormal manure, that's going to be a problem. So this first calf on the left-hand side, to me, this is great, normal 10-day-old calf diarrhea, right? Nice clean butt, you see on that second picture, right? But if you're walking by your calves and you see these wet tails or mucky butts, I'll call them, right? This is evidence that this calf has abnormal manure. Even if she's eating and drinking still, this is abnormal. This increases her likelihood of having pneumonia. Our work would suggest that calves that have abnormal manure are twice as likely to develop subclinical disease. So it's important to understand how much of a risk factor GI disease is for pneumonia in your operation. Here's some manure that is, it's not too loose, but it's very slimy. It's very slippery looking, very shiny, because there's too much mucus in there. And there are specific pathogens that can kind of increase the secretion of mucus in the large intestine. And again, we don't necessarily need to chase the pathogens, but we need to recognize that there's some GI upset going on. So when I showed you those numbers with mortality dropping after implementing a program, it's because we're tuning into these things. The other thing that we see is tuning into navel infections, right? So an ultrasound here is an infected navel. Every cat that gets a lung ultrasound really needs to have their navel palpated as well, because we're finding a lot more of those diseases. And lastly, again, because you're out there with the calves, what we see is that we can see some subtle signs of abnormal respiratory tracts in these calves when the calves are at rest. So if you're only checking calves for disease or being around, we just these more subtle signs of this respiratory rate or the respiratory effort, right? In this calf on the left, just compare the calf on the right, which is slowly. So I wanted to highlight this because we talk about respiratory disease and we talk about the lung ultrasounds, but it ties into the global picture about managing calves. All of that information helps you know exactly where the problem is and figure out those risk factors for it. And then you can work around and figure out what's going on, right? So if you haven't seen lung ultrasound in person, this is what it looks like, the technique that I train. And I train individuals to be able to hold a calf by themselves, spray with alcohol, and do the ultrasound. Again, this is a student. This is about his second day of doing ultrasounding with me, and it takes him about 2 minutes to do a complete scan, left side of the chest, right side of the chest. But seasoned veterinarians are going to be able to do 40 to 50 calves an hour. If they're working with a technician, that can be as high as 75 calves an hour. So it's very, very rapid fire scenario. And what we're doing is looking for the difference between normal lung, which is just a series of horizontal white lines. We can see that here in this right-hand image, just horizontal white lines, versus this gray kind of speckled appearance of lung tissue when it's abnormal, right? So this shows up right here. This is what we're looking at, right? So horizontal white lines, normal, speckling, solid tissue, not normal. That's really all we're demonstrating here. Um, I think I see that it's about 11:45 right now, and I have some slides here on scoring that I will just zip through. We have a scoring system, 0 to 5, with 0 being completely normal. Again, those horizontal white lines. A 1 is just kind of fuzzy looking lung. You can see here on the screen, and we honestly don't see that very often in dairy calves. When we do, it suggests that there's septicemia going on, or some other condition that's a bit different than typical pneumonia, typical bacterial pneumonia, okay?
So,
If
Terry,
you
I
see
do have a
this,
question for you. We
yeah,
do have two questions. One can
yep.
wait for a little bit later, but one was regarding while you were talking, and when you play your videos, your audio breaks up a little bit. But there was a
Okay.
question to please repeat your statement about feed intake.
If I could only remember my statement about feed intake. I I might have made a general comment about nutrition and its relationship to lung health and performance. I think what I'm a believer in feeding calves what they would eat if they were with mom, right? So historically, we've underfed calves. We've restricted feed them milk for decades. And we're getting better about that as an industry, but there's still a lot of producers that don't feed enough volume or high enough quality of milk. And the reason I really think nutrition is important is because we need to make sure that these calves have enough calories to develop a good functional um, uh, immune system. And if calves aren't growing very well or not having enough calories to grow well, I don't know that they're going to be developing an immune system like they ought to, right? So if I know calves grow well, then it tells me immune system's probably got the necessary nutrients to do what it needs from an immune status point.
He was referring specifically to the video that you had of the two calves side by side and what you were referring to when you
Okay,
had
yeah,
that
and
video
that
up.
Yeah, and that so not so much about feed intake in that picture, but what I was demonstrating there is that right here, and I'll talk you through this, and then I'll play it so you can hear me. But a lot of people historically, we feed calves 2 or 3 times a day, and you figure out who's sick based on who doesn't finish their milk, right? There are subtle signs associated with respiratory disease that during feeding time are really hard to see. And one of those things is going to be increased respiratory rate and more importantly, increased respiratory effort. So when I click play, you're going to see that the calf on the left has a more rapid respiratory rate, and also she's kind of pushing the air out. So expiratory effort. When they push the air out, then that is very significantly associated with lower airway or lung disease. Okay, the calf on the right is a normal calf and just has nice even in and out breathing pattern. So, but we can't see this during feeding time because the calves are up bouncing around, being really active typically. So the point here is to make sure that somebody is checking on the calves a couple hours after the morning feeding so that you can see them when they're resting, see them when they're quiet, and see this very subtle difference. So again, the one on the left, you can see increased rate and increased effort, so pushing the air out compared to the calf on the right. Right, with that black calf on the right, it's almost kind of hard because she's breathing so calmly and evenly. It's even hard to kind of see it in the video, but hopefully that answers the questions that you were asking. If
Yes,
not, please
it
follow
did.
up.
Thank you. We do have a couple of other
Okay.
questions, but we'll
Yeah,
get to your other points that you want to make, and we do have a couple of other questions we'll get to before we finish.
yeah. I just finished on the lung scoring, right? We can score these calves, and my goal is when we're treating calves for their first time, most of these calves are going to be a score 2, maybe some are a score 3. But if when we're scanning them, if they're getting treated for the first time when they're 4s, so they've got 2 lobes completely consolidated, or 5, and there's 3 or more lobes completely consolidated, that tells me that we're not finding the calves early enough, that the lung disease is too severe when they're getting treated for the first time. Um, all right, so I think I want to stop there, and I'd rather take the time to answer questions. And I can always pull up some slides if it's helpful.
Yes. So the first question was, what are your recommendations for managing calves that test positive for subclinical BRD at the start of weaning?
Yeah, so I'm going to answer a question with a question. It depends on the history of that calf, right? So let's say we're doing the wean clean thing. We're going to go out and scan a bunch of weaning age calves to see what proportion of them are positive for disease. And if there is a high number of them positive, or even if you have an individual calf who's positive at weaning age, what do you do with that information? If the calf is, you got to go look at her treatment record. Has she ever been treated before or not? If she has been treated before, how many times? When? Did she have any lung scans prior to that? Um, at that weaning age, if she's never been treated before and it's a good score 2 or score 3, I think our data would say to treat her. That post-weaning, right? If it's after weaning and there's small lesions, we don't have a lot of data to say that those calves, if they're subclinical, ought to be treated. But if they are entering the weaning phase and they have a significant subclinical lesion and they've never been treated before, I would treat them. If it's a very small lesion, they've been treated multiple times, I probably would not treat them. So you've got to look at the whole picture of that calf and what came before in her treatment history and her lung scans to know kind of how to use that information. Hopefully that answers the question. Next question.
Next question.
Oh,
When you
and
mentioned,
I'm sorry, I'm going to interrupt and just
go
say,
ahead.
so that's just the treatment side of things. I get asked, should you separate them? Should you hold them back? And I haven't seen any evidence that suggests that separating that calf out is going to be a winning thing to do. I haven't seen any data that says holding them back is going to make a difference. So in the subclinical phase, right? So I would just say if they're subclinical at weaning, hasn't been treated before, she's well grown, go ahead and treat her. She's not well grown, it tells you it's probably been chronic and you need to make the decision, do you want to keep her around or not? Okay. Okay.
Okay. The next question. When you mention manure, I think of the importance of gut-lung axis. Would you link the gut barrier function and manure to subclinical respiratory disease?
Absolutely. Absolutely. I think if we could make sure that these calves have perfectly stable guts, right? So normal manure, no GI upset throughout the first few weeks of life, I think we're going to significantly reduce their risk. Our data says that those calves are twice as likely to get subclinical disease if they have abnormal manure. So we're still learning about the gut-lung axis and what that connection and how it all works, but it's a significant risk factor. So I definitely think the gut barrier function and manure quality is our data absolutely says it's linked to respiratory disease, to subclinical disease. That's why I emphasize if you're in scanning a calf, the first thing you do when you walk in that pen is you characterize the manure. You look at their butt, see if it's clean or dirty. You look on the ground for manure, and if you see any fresh manure, what's the quality of it? That also brings into the point that when you're there, did they just put new bedding down, right? So every calf has nice, it doesn't have abnormal manure if it's all covered with fresh shavings, right? So again, that's where looking at the butt of that calf, looking for dried manure, looking for hairless butts, the little monkey butts. That tells you that that calf did have abnormal manure at some point in time. That's important information because anything you can do to make a more stable gut, more stable manure quality is going to lead to better quality lungs, better lung health.
Okay, so the next question is there a benefit to using lung ultrasound as a diagnostic on a smaller scale? For example, 1 to 2 calves in a small scale or backyard situation.
Yeah, absolutely. So it all comes down to the questions that you want to answer, right? And if you just have a couple calves that you're raising at a time, right? So um, it's it's very useful at the individual level, like if she's not, if the calf is, it has any visible signs of disease, doing a scan on that animal is going to help the vet characterize, well, does she actually have pneumonia and how severe is it? And how well do I think she'll respond to treatment based on what I see on the ultrasound? So from an individual animal perspective, just having a couple calves in that you're raising, absolutely useful tool on the individual level, having a good quality diagnosis. And then if you want to just, check those calves even if you just have two at a time when you're weaning them, it's going to, over time, you accumulate data to figure out how good are you at getting your calves to the weaning period with nice clean lungs. We need about 12 calves to have an estimate that we're confident is kind of accurate. So if you're only raising two calves at a time, it's going to take you time to collect that information. But it can still be valuable. It all just comes down to what you want to know and what you're trying to figure out. If you had a calf that was sick and you treated it, you can use that ultrasound to help you know, is it okay to stop the antibiotics? Are her lungs better now? Are her lungs cured? Because a lot of times the visible signs of disease, the snotty nose, the coughing, the fever will go away, but the lungs haven't actually cured yet. And so at that small level, just a couple calves in your background, it can help you, backyard, help you figure out from a treatment perspective, do you keep treating or not?
Okay, actually, I'll have you turn your camera on if you're kind of done with your slides. I have a
Yep.
two-part question here. So for farms that are hesitant about the cost, what would you say to them? And this is kind of the second part. Should this tool be used for every calf or just high risk groups or just problem pens? We're in a little bit more difficult, challenging times when it comes to dairy prices and milk prices, and people are looking to maybe cut costs, and sometimes cutting costs in certain areas isn't necessarily the most cost effective in the long run. So how do
Yeah.
you convince or how do you help farmers see the value in this long term?
Yeah, I think the first step is going to be to characterize the dynamics of disease in your calves, right? You have to know how much disease do you have, how much of it's subclinical, how much of it's clinical, and when is it subclinical? If it's subclinical to start, right, then those are the dairies that really benefit from routine scanning of those calves most likely to become affected with subclinical disease, right? 10 to 14 days or 14 to 21 days. And then routine scanning of that age group every week helps you identify them as soon as they get subclinical pneumonia, and then you can implement treatment, and then they will respond and be less likely to have clinical disease. But if you do an assessment, or your vet does an assessment, and you have more clinical disease than you do subclinical disease, then you can use that information to characterize, well, how bad are the lungs when they're getting treated for the first time? Yeah, they're raising their hand and telling you they're sick, right? So you don't necessarily need the tool to identify who's actually got pneumonia, but you can use that tool then to figure out, are they responding to treatment in the way that they need to be? Are we treating them soon enough, right, when the lung lesions are small? Um, so it really comes down to kind of the characteristics of disease in your calves. If you know you have high risk, if you are a calf raiser and you're getting calves from multiple sources, a scanning on arrival or a scanning by source farm, you can figure out, well, farm A has a lot more risk for subclinical disease, farm B, more clinical, the age of onset. You can kind of tailor your approach based on that source farm and what you find with the dynamics based on that assessment. So it comes down to, it's going to be a little bit different for every farm. Scanning every calf from 10 to 20 days old isn't going to be appropriate for a farm whose pneumonia starts around 30 days or 40 days. And again, if they're clinical when they first get pneumonia, routine scanning isn't going to be helpful because they're already telling you that they're sick. So you got to kind of figure out what's going on in your own operation to figure out the best way, to figure out what questions you want to answer. Hopefully that helps that question. And it's really important. What are you going to do with the information, right? There's
Yep.
no point. There's no point. It's a labor intense job. There's no point in doing it if you're not going to do some action associated with the results.
All right. One quick last question, and then we'll wrap up. How often do you scan a calf? Is that just strategy for each farm, or is that something that is kind of standard?
Yeah, again, it comes down to why you're scanning the cat to begin with. If I scanned her today and I saw that she's got lung lesions, and I'm going to treat her for the first time, I will rescan her probably 7 to 10 days later to see how she's responded to that treatment, provided clinically she hasn't changed at all. So it depends on if you're trying to figure out how she's responding to treatment, or are you monitoring subclinical disease, and you just want to make sure you find these calves as soon as possible. than weekly is typical for most dairies. Unless they're on the smaller side, it might be every other week when the veterinarian is there. So again, it comes down to why you're scanning in the beginning, scanning to begin with, how often you're going to follow up.
All right, we have one more quick question if we can get through it. If you scan a subclinical calf with a lung score of 4 to 5, and then you scan the calf again after treatment and the lung score is still high, how do you decide if you should continue using antibiotics on that calf?
Yeah. So what I'm hearing is basically she's got severe pneumonia. We'll just say, let's say she's subclinical. Is that part of it? She's got subclinical. She's 4 or 5. You treat her. You come back a week later, and she's still a 4 or 5. She's still subclinical. If that first treatment was really her first time ever being treated, she hasn't improved at all in that week's time, and she's still well grown, I would probably switch an antibiotic and try something else. I would retreat her with something else. If she was a little bit better, let's say she was down to a big score 2, maybe a 3 from a 4 or 5, I probably would give her another dose of the same antibiotic that she already had. Okay, because she has some response, she just needs more prolonged treatment. If she was, let's say she's a 4 and now she's a 5 a week later, then again, I would change the antibiotic and treat her again. That's my perspective. You as a producer, the owners, in subclinical animals, you have the ability to say, all right, we have too many calves to begin with, right? If she's not responding to the first treatment, I have another calf that can take her pen, right? That can take her spot on the farm. You can decide to not retreat if she's subclinical and see what she does, right? That's your prerogative. And I don't have a problem with it, especially if she's older, and she's just kind of stable. If she's clinically stable, she didn't respond, you gave her one chance with an antibiotic, but it didn't happen. I would just flag her in the system so that you know that when she does become clinical, you need to either treat or cull, or euthanize, right? If they become clinical, you have to do something. You can't sit on them. I'm okay sitting on them if they've been treated at least once with subclinical disease, all right? But once they're visibly sick, you have to do something with that animal, whether treat or euthanize or cull. And if they are severely ill, we're not going to put them on a trailer, right? You're not going to send them down the road. You're going to have to euthanize. If you're not willing to treat, you're going to have to euthanize. And that's okay, right? It's never a bad option, proper euthanasia. There's a veterinary ethicist out there, Bernie Rollins, who said a long time ago, a week too early is better than a day too late, right? We shouldn't hesitate to do proper euthanasia on these calves if they're not responding to treatment.
Right.
Provided you get them identified and treated as best you can.
Okay, well, thank you, Dr. Ollivett. If you wouldn't mind forwarding down to the end of your presentation here to those
Yeah.
other slides. So I hope you enjoyed today's webinar. We're focusing on lung ultrasound to detect respiratory issues in dairy calves. Please join us next month, March 17th, for Virtual Fence Meets Pasture Nutrition for maximum productivity. Join us for a timely webinar on how virtual fencing and pasture nutrition work together to support high-producing dairy herds. This session will explore the balance between forage availability and targeted supplementation to drive performance. Register now to secure your spot at go.wisc.edu/BDI. And additional information, and for additional and unbiased information, university-based dairy resources, please visit Extension Dairy Program at the web at dairy.extension.wisc.edu or find us on Facebook at Extension Agriculture. Thank you and have a great day.